My name is Angela Seals, and I was diagnosed in April of 2022 at the age of 48. Shock. Shock more than panic. It was a phone call I received while I was at dinner with my husband. And we were at dinner the night before we were leaving for a trip. The doctor actually called, and to be honest, when I answered the phone, she introduced herself. This is Dr. Ray. It was Dr. Ray. She told me they received the results of my colonoscopy. And I remember thinking to myself, wow, it was my first colonoscopy. It's really nice at this place. The doctors actually called to let you know that your results were normal. That's the thought that went through my head, because I had no expectation that anything would be abnormal. Although I knew when I left there were, I think she said I had 5 or 6 polyps that they cut off. Well, she let me know that one of the polyps was a carcinoid tumor and that it was malignant, and that I would have to come in for her to take that off and to look closer to make sure there weren't any more. And I was in shock. I did not tell anyone. Luckily, my husband was on the phone as well with a client of his. So I was off the phone with her before he was off the phone, and he didn't even ask who it was. And we went on our trip, and I didn't tell him until a couple days before, because he had to take me, because I had to have a driver. But I was in shock, and it was scary. It was scary. I didn't know a lot about it, and I couldn't believe it. A friend of mine, Amy, had asked me, have you ever had a colonoscopy? No, I had not, because I thought it was age 50. You were supposed to get a colonoscopy, and I'll be honest with you, I probably wouldn't have went at age 50, because I don't have any trouble. You know, I feel fine. I don't have any stomach issues. But I told her no, I hadn't gotten a colonoscopy, no family history of anything. Well, you know, the age is 45. And she would mention it to me every couple months, probably. It's easy, just go do it. It's an easy thing to do, just go do it. And I thought, I'm just gonna do it, you know, so she'll quit telling me to go do it. And it's so easy, you know, it's so easy. So that is why I wouldn't have done it, and I'm so glad. I'm so glad she told me to go, and it's a good thing she did. It's a good thing I listened. The research that was available online, you know, of course I was Googling nonstop, which is what you're not supposed to do, but that's reactively what I did. The type of cancer that I had, you know, I did some research, found out it was slow growing, you know, probably had it for years and it was slow growing. Like I said, at first I told no one. So I didn't cope very well at first, but in doing the research that I did, and then ultimately speaking with Amy about it, who knew a lot about it, that helped. You know, I had some reassurance that it was okay. And going back and doing the follow-up with my physician and her taking that out and finding there was no more, and that helped as well. No, just went back a few weeks later, she took that, you know, took the surrounding tissue out because there weren't any margins was the issue. She took the polyps out. That particular one was the carcinoid tumor with no margins. So she went back into that spot, took some more of the area out, tattooed it, I think, so she could find that spot again. Looked around, didn't see anything else. There were margins on what she took, so she took everything that she needed. And I went back again this year for another colonoscopy. Everything was good. So, yeah, they could go back in 3 years for another check. I try to eat better. And I have told several of my friends who are at least 45, just talk to them about how easy it is. You know, before I thought, ew, I don't want to drink that stuff. Ew, I don't want to take all of, you know, you feel like it's a 3 or 4 day process. That's what I thought before. it's a whole week of my life because I'm going to be drinking this stuff and I'm going to have to, how do you work? Because you're going to be running back and forth to the bathroom. But it's so easy. It's too easy not to do versus not doing it and what could happen. So before I would have never talked to my family or friends about any kind of cancer prevention. But this I do. I talked to my brother, I've talked to him about it. He did go get screened and he was fine, luckily. And it's a subject I bring up that I never would have before. Probably again, it's much easier. If you've not had one before, if you haven't had a colonoscopy before, it is much easier than you think it's going to be. It's not as time consuming. It doesn't affect your week or your even, it's easier than you think, and it's well worth it. My first thought was, is she going to go back in there and she missed several places? Is she going to look in a more detailed way and find it everywhere? Am I going to be ate up with it? Am I going to be? So I was. It was hard. It was a hard few weeks. Just wondering and thinking and worrying and your mind, as you know, can go in a terrible places, and it did. And that's why I say it's just so easy to go get checked and find things out, and you don't have to, terrible things are too easy to avoid. Stay up to date on the recommendations. Listen to your educated and informed friends. And just because you look healthy doesn't necessarily mean you're healthy. So that's exactly what I would tell people.